Hey all, Dr. Crathen here again. I wanted to switch it up and talk about something fairly new, kind of the plastic surgery aesthetic realm. It's called Ozempic butt. Now, I know it sounds funny and most of you are probably wondering, what is Ozempic butt? Ozempic is another name for semaglutide, which are the weight loss injections. And semaglutide or Ozempic works. It's a weekly injection that kind of is an appetite suppression agent. And over time, by eating less food, people lose weight. And so we have thousands of people out there who are on this medication to lose weight and have lost 15, 20, 50 pounds or so. And what's happened is as people lose weight, the fat gradually goes away. What happens is if they had a nice round buttock area, as that fat goes away, we now have saggy skin and loose skin, and we call that Ozempic butt. Here at Holcomb Crathen, we specialize in this Ozempic butt phenomenon, and I'm going to go over a few ways on how to treat it. First thing that we can treat Ozempic butt with is this device called Morpheus 8. And it has these little tiny needles. What we do is we zap thousands of times the skin in the buttock area. That needle contraction will help the skin to lift and elevate. The other thing that it has is radio frequency energy. So through that dual phase of the mechanical part of the needles and the energy of the radio frequency, we can get that buttock skin to lift up. The second thing that we have to treat Ozempic butt is called Sculptra. This is an injectable that we place in the buttock region. It's made out of polylactic acid, and what it does is over time, it expands like a sponge. So with Ozempic butt, the issues may be there's a hip dip where there's a concavity or there's a lack of buttock projection. By injecting this medication into that area, it expands and it causes some lifting and fills in some voids. Another very effective treatment for Ozempic butt is called Emsculpt. Emsculpt device stimulates the muscle. So it's like doing 10,000 plus squats in one session. It's a series of treatments, let's say 6 over a 2-month period, and it stimulates through muscle contraction and builds the muscle volume up. So over time, that larger gluteus muscle will lift the buttocks up. So the last thing I want to talk about is a surgical option called a lower body lift. Kind of like a tummy tuck on steroids. Tummy tuck where you remove skin from the front, but then in the body lift, we actually go all the way around 360 and remove skin from the back. And so by pulling up the buttock area through the skin excision, we lift the buttocks, we lift the skin, we lift the outer thighs, and we can get a much better contour.